kind of a virus is it?
They can't identify it.
I think it's a synthetic virus.
Dr. Waleska is working on a cure for the common cold.
Dr. Waleska is working on more than that.
You are looking at Dr. Elizabeth Waleska's new research associate.
You treat illnesses with a few cuts and sutures, and then you nominate yourselves for sainthood.
Go back to surgery, doctor. You don't belong here.
Epidemic!
All this from a homemade virus.
Okay. How are you supposed to find anything around here? You can't even find the bulletin board. Look at this, it's so old, it's yellow. And my notice on ship changes hidden on the parted cloth.
Well, what do you know? My parental guidance class was last Monday. Great.
Jackson. Easy, Stan. I got pushpins stabbing me right and left.
I thought I left a message for you to take over on the supply committee for me yesterday.
Well, that's news to me. You try finding it on this mess, huh?
Oh, that is the sorriest excuse I've ever heard.
And this is the sorriest mess I have ever seen. Now, something has to be done about this.
Yeah, I can't find anything on this thing.
Okay, you're right. Something has to be done.
Hey, Trap, just coming to the opening? The research center, remember?
I have a pressing engagement.
What, racquetball? With Gretchen? Why humiliate yourself? She's just gonna demolish you like she did in tennis.
Racquetball is very different from tennis, my friend. It's all in the wrist. Today will be different.
Come on, Trap. It's the big event. It's a hot project.
Pay my respects and stay away from the punch. You promised to take the Wiley case for me, remember?
Yeah, I got Henderson to fill in for you.
What's wrong with you?
Got some news. You are looking at Dr. Elizabeth Waleska's new research associate.
Research?
Mm-hmm. Part-time, of course. I mean, it's sort of unofficial, you know.
Our schedule is jammed. We're barely managing, and you want to hole up in a lab someplace and play with mice? Come on.
Hey, it's more than that, Trap. How often do I get a chance to work with someone like Liz Waleska? She's the biggest name in research. And get this, we're working on the common cold. You want to bet we find a cure?
I'm sure you'll make a lovely couple.
We are all aware of Dr. Elizabeth Waleska's tremendous accomplishments in the field of medical research. And now that she is here as director of our own research center, we can look forward to even more stunning achievements. Dr. Waleska, it is with great pride we welcome you to San Francisco Memorial.
Thank you. Now, we all know research is dedicated people and ideas and damned hard work. All in ample supply here. So, here are the refreshments. Let's eat.
Gotta go. See you later.
Okay. She's one hell of a lady.
Yeah.
Wouldn't mind working with her myself.
Good. We'll need volunteers for the cold project.
Me? I've never had a cold in my life.
Mm-hmm.
You see, terrific. Dad personally authorized this project. Too bad he's in Bermuda. Great project.
Gentlemen, if you please.
Not bad for the new kid on the block.
Yeah, well, always leave them laughing. S. Riverside?
The second.
Oh, any relation to the chairman of the board?
He's my father. Dad told you about me, did he?
Oh, it's funny. He didn't mention he had a son.
So, how was Gretchen?
When you're hot, you're hot. When you're not, you're not.
Ooh, that bad, huh?
2 out of 3.
Maybe you ought to take up something a little more tame. How about golf? You're a doctor.
She has a 7 handicap. Come on, we're late for rounds.
You mind going solo today? I want to go over to the research center, help Liz set up shop.
Oh, I see. Well, if you're going to get wrapped up in all that stuff, maybe you should just take a leave of absence.
Come on, Trap. I told you it's only part-time.
I see. And just how do I get a part of your time? For instance, I'd like to hear some of your thoughts on the Farrell case.
I looked in on him this morning. We can't operate on him until he gets over his sinus infection.
Oh, nice of you to notice.
But we ought to have Dr. Waleska take a look at him. And he'd be a perfect candidate for that coal project.
Mr. Farrell did not check into this hospital to become a guinea pig.
Yeah, but if you can help him.
Leave her out of this, okay?
Do I detect a trace of hostility? Well, professional jealousy doesn't suit you, Trap.
She and I go back a long way. Let's just say that she's headstrong, opinionated, and a little overzealous, okay?
Sounds like Madame Curie.
Sounds like trouble.
All right, every note, memo, and bulletin has a color code and a column. So all you have to do is use the right color index card.
What is it, Sesame Street?
Oh, don't get smart, Jackson. Now, with my system, missed meetings will be a thing of the past. See? So here's the way it'll be. Yellow for committee meetings. Blue, hospital activities. White, personal memos. And red, blood bank and anything to do with blood.
Notes will still get buried, Stan. The board isn't big enough, and there's not enough colors.
And look at all these business cards. There's enough to cover the whole board, to say nothing of the people who want to buy, sell, trade.
Yeah, the flyers we get, they all come in their own color.
For Pete's sake, people, I'm just trying to establish a little communication around here.
Better off putting our business in the classified ads.
Oh, ho hum, Shoop. That's just the kind of negative attitude that spoils. Wait a minute. Wait a minute, that's it. We could start a newspaper. No, a newsletter. This is terrific. That would cover everything. We could have personals and bulletins and ads and meetings and memos and messages, world events.
World events?
I took a journalism class in college.
We could put in birth and death and hospital announcements. What can we call it? The Memorial Messenger. Catchy, huh?
Introduction to journalism. I got a pretty good grade in it, too.
Now, naturally, I will assume the responsibilities of editor-in-chief. Shoop, you can start a personals column and maybe a little recipe column, too.
Recipe? We do not have time for that, Stanley.
Rakuzi, I'm going to assign you the child care beats, since that's, that's your thing lately.
Right.
Jackson, you can take sports, ski reports, and all the rest of the weather. I'll cover the top stories, the really tough stories. We want this first issue to be a zinger. Oh, gee, I'm going to have to find a printer.
A newsletter. You're dreaming. You are dreaming.
Listen.
Take a miracle, Stan. A miracle.
It's going to be great, troops. Listen, deadline's Friday. Go get 'em.
You know, if I hadn't gone into nursing, I seriously would have considered journalism.
Really?
Yeah.
Antihistamines, vitamin C, herbal teas, they all spell relief. But none of them provide a cure.
Think you find any answers in the viruses you've isolated?
That's what I'm here for. You realize what a killer the cold virus is, especially in the underdeveloped countries.
I hate the little bugger already. Listen, maybe I should take a look at some of your research notes, start to get familiar with all this.
In due time. Rinse this out, please.
The lab attendants will clean up. Let's review the backup on this.
Oh, there's no sense in boring yourself with that. I'll fill you in as we go along. I could use a cup of coffee.
Liz, let's get something straight. If you're looking for an errand boy, find someone else. I've got enough going on in surgery to keep me productively occupied.
You are my assistant, aren't you?
No, I agreed to work with you. A limited partnership on a specific project. That's quite a difference.
And what do you think you can do for me?
Oh, for starters, get to know the specifics of your experiments. Correlate data, drum up new approaches, play devil's advocate, whatever. What?
Just testing the waters. It's been a long time since anyone called me. Either way, I'll probably end up driving you crazy.
You don't scare me, lady.
I'll keep working on it.
Listen, you've had a lot of success with that anti-cold medication of yours, and I know it isn't approved yet, but I was thinking. We had this patient named Farrell, Bill Farrell, and we need to get him on the